there's the map of Hamilton County, and you see here, highlighted in red, is Colerain Township. 14th largest community in the state of Ohio. We cover about 45 square miles. We house about 60,000 residents within about 23,000 living units. We run out of, this fire department-wise, we run out of 5 fire stations, 170 uniformed personnel, and we staff 33 people 24 hours a day. Fully staffed, that is. I know you guys can identify with staffing. From the law enforcement side, we have 54 uniformed law enforcement personnel and 6 beat officers who run 24 hours a day. So that's kind of the little bit of a makeup of our public safety entities. And real quick before I go on, I know I see all of our uniforms here, but for my fire and EMS personnel, raise your hand. Okay, and law enforcement? Okay. I think so. I commend you guys, and the reason I say that is we've been around, we've been doing this talk quite a bit now. From Texas, we were in Wilmington, North Carolina, beginning of November, and what we see a lot of health professionals that are involved on the counselor side. We see a lot of those types of health agencies. What we don't see is this. And kudos to you guys, to your area up here. This is awesome. This is fantastic. Out of the 300 people that we talked to in Wilmington, 300 people were there. There were 5 fire and EMS personnel. That's where we need this level of engagement. Why? Because we have the ability to affect change at ground zero, where the overdose occurs, right? So people ask, why get fire involved, fire and EMS? Hopefully we're going to paint the picture why, but we have that capability. We're there. We're in the homes. We're in the homes anyway. So again, thank you guys for your involvement. Here's our overdose picture. Going back to 2011, we had 51 opiate-related overdoses. When I use the term overdose this afternoon, I'm referring to opiate-specific overdoses, not the overdose on Tylenol type stuff. These are actual opiate-related overdoses. And much like many of the communities in the state of Ohio, we saw drastic increases right around that same time period. I'm not used to having all these screens up here. This is great. I can see the data no matter where I am. 115 in 2012, and you can see the numbers there. Up until September of this year, we were headed toward a 10% reduction in overdoses. We were on pace to respond to 151 in 2016. And then September happened. Do we recall what happened in September up here and kind of spread down south? Carfentanil was introduced. We were hit with 50 overdoses in September, 50 opiate-related overdoses in September alone. September, October, and November, we responded to 100. This crushed us. It absolutely crushed us. So no longer are we on that pace for that reduction because the last few months have hit us really hard. November, we were down to 14. So really September and October were our 2 hardest months. In 2015, our department responded to 7,520 emergency medical runs. Out of that, the overdose runs only represented 2.2% of our run volume. So then I get asked the question, when we talk about resources, why are we applying so many resources to only 2.2% of our run volume? That's a pretty small percentage. I mean, we're not doing that for our allergic reactions and things like that that also represent 2.2% of our run volume. So why? It's the impact. I think we understand this. The ones who need to hear this aren't in this room, but it's the impact. The impact of that 2.2% of our volume is much wider, much greater, and much more severe than any other numbers we can present. So that's why. And it's pretty easy to represent, and like I said, everybody in this room understands that. They get it.